Hello, I'm Garrett Thomas, and today I have the pleasure of speaking with Dr. Chris Vaughan, who is a licensed pediatric neuropsychologist. Dr. Vaughan is a member of the Division of Neuropsychology at Children's National Hospital. Dr. Vaughan is the Assistant Director of the Safe Concussion Outcome Recovery and Education, or SCORE program. He is an assistant professor in the Departments of Psychiatry and Behavioral Sciences and Pediatrics at the George Washington University School of Medicine. He is also a fellow and the treasurer of the Sports Neuropsychology Society. Dr. Vaughan will be speaking at the upcoming SNS Symposium, giving a talk titled A Review of Rest as a Treatment for Concussion. Dr. Vaughan, thanks for being willing to speak with me today.
Thank you, Garrett. I appreciate the opportunity.
Yeah, absolutely. So to get started, can you tell me a little bit more about your upcoming talk and sort of give a quick description of what you plan to present?
I will do my best, but in full disclosure, the talk is not yet finalized, and so please take some of this a little bit softly. No, I'm very interested in the topic, largely as a clinician who spends a good portion of my week working with kids and families. And certainly when I became involved in the world of concussion as a clinician and researcher back in 2007, there was a lot of movement towards rest as, frankly, as a recommendation. And I remember in the 2008 consensus conference meeting in Zurich, talking about how we just really were using this term and lacked a definition. We were, at that point, starting to develop some research and understanding around the topic of rest, but it wasn't well defined. And so, without a clear definition, it's hard to know what we're studying or, frankly, again, what we're even recommending. As you and the audience may be aware, there's been a lot that's changed in the last 16 years regarding both our understanding, but certainly perspective on rest. And while my talk is not going to be the first to do this, there are a number of very good review articles looking at both treatment and the context of how we talk about rest through the years. I think it's an interesting lesson and perspective to take on why we first started using that term, what it meant, what some of the early studies were showing around the topic, when that shift started to occur and why in the mid-2010s, and look at kind of what our perspectives are now on the topic. And not to spoil the conclusion on this, but I think ultimately there's still a lot that we don't know. And I think there's a lot of understanding that we need to gain through further research and refinement of some of the work that's already been done. There's very much been a pendulum shift in certainly regarding rest and treatment overall, but I think it's pretty clear to me, and I hope to present to the audience, that we really haven't answered a lot of the questions that we still need to answer.
Yeah, no, I think that's a really great overview. And you mentioned a shift and a change and sort of thinking about how we think about rest, right? And sort of it seems like gone are the days of saying, hey, go sit in a dark room until your symptoms completely go away, but really encouraging people to, in a way that is safe, but getting back to doing things, returning to activity, whether even if it's sort of in a moderate amount, how do you sort of present that to patients or talk about that with families and sort of, finding that Goldilocks zone between, getting back to activity quickly and safely, but also, not resting too long?
Yeah, no, I think that's a very good point. And I think, one of the big gaps in the research around the topic gets to that point, which is that in many ways it just needs to be individualized. I mean, we're looking at that person's background, their injury, frankly, what has happened to them since their injury and how their recovery is progressing. And using that framework allows us as clinicians to change the message in different ways. I mean, I think fundamentally we want to be reassuring and optimistic. We want to be realistic as well. But how we recommend or emphasize a certain treatment approach, whether it be pushing somebody towards more activities or perhaps, encouraging them to back down on certain activities, really depends on how their recovery is going and frankly the person that you're talking to and what stressors or background characteristics like anxiety they may have going into it. And ultimately the goal is that they get better. And so that message varies based on the person.
Yeah, no, I completely agree. I think individualizing things as much as possible, is really important. And, the idea that if you've seen one concussion, you've seen one concussion, and everyone's recovery is going to be, different. And yeah, these guidelines are helpful, but again, really trying to personalize as much as possible. Um, and sort of thinking about, big picture, right? Sort of thinking about getting this message to the public, but also to, everyone else that will be attending the SNS conference. What do you hope that fellow neuropsychologists and other providers will gain from your talk?
I think, and I could be wrong on this, but I tend to view the SNS audience as a fairly well-informed group. And so, on one hand, I don't expect to wow them with cutting edge information that they're probably not tuned into already. I do hope, and what I've learned in preparing the talk so far is a little bit of a history lesson around the evolution of the concept. And for me, at least, I think it's helped to open my eyes a little bit to how we may go a little bit too far in our perspectives when we start to see certain studies come out, or we collectively start to say things in certain ways around a topic that do we really evaluate the science that we have to make those decisions? I mean, I don't think any of us felt like we were saying something wrong back in 2013 or that we're saying the wrong things now. But I think it's important that we understand that we're still going to learn more, and that message is going to evolve as we do. And so we need to be careful not to get too confident or too set in our ways with the perspective that we're providing. And I will tell you honestly, I mean, there's a little bit of a personal message to this for me, in that one of the papers that was referenced in the 2010 pediatrics guidelines was a paper that we published back in, I believe, 2009. I'll have the correct dates in my presentation, I promise. But we had talked about, maybe the idea that rest was going to help improve recovery. And at that point we were saying, well, we know that too much activity often causes people to describe increased symptoms. And so, we were trying to talk about that phenomena. But we took it a step further and we said, well, maybe rest is going to help. Well, that statement, without science and evidence, became a reference for recommending rest. And, at the time, I didn't think we did anything wrong. And in retrospect, I still don't think we did anything wrong. But at the same point, it to me really highlighted how the messaging is so critical, because I will, start to take things that I read and broaden that beyond maybe what the science is there to support. So again, the take home that I'm looking for is hopefully for all of us to remain a bit critical and skeptical, and to continue to search for ways to improve our science and ultimately our treatment and care for the families and individuals we work with.
Dr. Vaughan, this has been fantastic. I'm really looking forward to hearing your talk at SNS, and thanks again for speaking with me. We look forward to seeing you at the SNS Symposium in Philadelphia this May. Those of you who are listening, you can read more about the conference and register to attend on the SNS website at sportsneuropsychologysociety.com. You can also follow SNS on Facebook and Twitter. Dr. Vaughan, thanks again.
Wonderful, Garrett. Thank you. I appreciate the opportunity. See you in Philadelphia.